Welcome to the Therapy Trainings Podcast, where we delve into the world of mental health, helping professionals like you navigate the complexities of diagnosis and treatment. Today, we're focusing on the course titled Diagnosis and Treatment of Mental Health Disorders, DSM-5-TR Edition, offered by Therapy Trainings. This episode is a companion guide to that course, designed to highlight key points and provide additional insights that are crucial for your practice. So, whether you're a seasoned therapist or just starting your journey in mental health, this episode is packed with valuable information you won't want to miss. In this episode, we'll explore the evolution of the DSM, the diagnostic criteria for various mental health disorders, treatment approaches grounded in evidence-based practices, and we'll also tackle some common misconceptions that can arise in our field. As mental health professionals, it's vital to stay updated on these topics, not just for our own knowledge, but for the benefit of our clients. So, let's dive in. First, let's take a moment to understand what the DSM is and why it's such an important tool in our field. The Diagnostic and Statistical Manual of Mental Disorders, or DSM, is published by the American Psychiatric Association. The DSM serves as a guideline for diagnosing mental health disorders, and it's continually updated to reflect the most current research and clinical findings. The most recent edition, the DSM-5-TR, which stands for Text Revision, incorporates updates that enhance our understanding of mental health disorders. For instance, it addresses cultural considerations in diagnosis and treatment, acknowledging that mental health does not exist in a vacuum. Factors such as ethnicity, cultural background, and social context can significantly influence both the presentation of symptoms and the effectiveness of treatment options. This shift towards a more holistic approach is essential for providing culturally competent care. Now, let's delve into the diagnostic criteria outlined in the DSM-5-TR. Each disorder is categorized by specific symptoms that must be present for a diagnosis to be made. For example, let's consider major depressive disorder. According to the DSM-5-TR, a diagnosis requires the presence of 5 or more symptoms during the same 2-week period. These symptoms must represent a change from previous functioning and include at least one of the following: a depressed mood or loss of interest or pleasure in most activities. Understanding these criteria is not just about memorizing lists, it's about using them as a framework to guide your clinical judgment. As you interact with clients, it's crucial to conduct thorough assessments that go beyond surface-level symptoms. Engaging in a collaborative dialogue can help uncover the complexities of their experiences. But what about treatment options? The DSM-5-TR emphasizes evidence-based practices, which are grounded in the latest research. Cognitive behavioral therapy, or CBT, is one such approach. CBT focuses on identifying and challenging negative thought patterns and behaviors. For instance, if a client feels trapped in a cycle of negative thinking, CBT can provide tools to help them reframe their thoughts, fostering a more positive mindset. Another effective treatment modality is dialectical behavior therapy, or DBT, which is particularly useful for clients with borderline personality disorder. DBT combines cognitive behavioral techniques with mindfulness practices, helping clients navigate intense emotions and improve interpersonal relationships. The beauty of these approaches lies in their adaptability. They can be tailored to fit the unique needs of each client. Now let's take a moment to address some common misconceptions surrounding the DSM and the treatment of mental health disorders. One frequent misconception is that the DSM is merely a checklist of symptoms. While it does provide a structured way to diagnose disorders, it's essential to remember that mental health is not one size fits all. Each client is a unique individual, and the DSM should serve as a guide, not a definitive answer. Another misconception is that a diagnosis equates to a life sentence. This can be especially daunting for clients. However, it's important to communicate that a diagnosis is simply a tool for understanding their experiences and can guide effective treatment. Recovery is not only possible, it's a reality for many individuals facing mental health challenges. As mental health professionals, we have the responsibility to empower our clients by helping them understand that they are not defined by their diagnosis. Instead, we should focus on fostering resilience, promoting coping strategies, and encouraging a growth mindset. Now let's pivot a bit and consider the role of cultural competence in diagnosis and treatment. The DSM-5-TR highlights the necessity for therapists to be aware of cultural differences that may impact diagnosis. For example, symptoms of anxiety and depression can manifest differently across various cultures. What might be considered an outward expression of distress in one culture could be viewed as a sign of strength or resilience in another. Being culturally competent means actively seeking to understand your client's background, values, and beliefs. It's about asking the right questions and being open to learning from your clients. This approach not only enriches the therapeutic relationship, but also enhances the effectiveness of the treatment plan. Let's take an example. Imagine you're working with a client from a collectivist culture where expressing emotions is discouraged. They might present with physical symptoms rather than overt emotional distress. If you're not aware of cultural nuances, you could misinterpret their condition. By being culturally aware, you can adjust your approach and create a safe space for them to share their feelings in a way that aligns with their cultural norms. As we wrap up this discussion, I want to leave you with some thought-provoking insights. The mental health landscape is ever evolving, and as professionals, it's crucial to stay informed about the latest developments in diagnosis and treatment. The DSM-5-TR offers a wealth of knowledge, but it's our responsibility to apply this knowledge with empathy, creativity, and cultural sensitivity. I encourage all of you to engage with continuous learning opportunities, like the course offered by Therapy Trainings. Not only will it enhance your skills, but it will also ultimately benefit your clients. Remember, the goal is not just to treat a diagnosis, but to foster healing, resilience, and growth. Before we conclude, I invite you to check out therapytrainings.com for more courses that can expand your knowledge and expertise. Whether you're looking to deepen your understanding of specific disorders or explore new treatment modalities, there's something for every mental health professional. Thank you for joining me on this journey today. I hope you found this episode insightful and that it inspires you to continue exploring the fascinating world of mental health. Remember, we're all in this together, advocating for our clients and promoting mental wellness in our communities. Until next time, keep learning, keep growing, and keep making a difference in the lives of those you serve.